Right. It's very serious. It's very serious. Yes.
Road accidents in the Gambia are becoming a death trap for commuters, road users, and passengers in the smallest African nation. Within 1 month, road accidents claimed lives of over 30 people in the Gambia.
This is the gowning process. Here, those people who are going to take part in the surgery will have to clean themselves first. And the blue gowns you see them wearing are sterile, meaning to say that they've been processed so that they do not have any infection, or it is reduced to a bare minimum. So now they're going to wear their sterile gloves as well. These are gloves that are also processed and sterilized. And once they're done, you will see they will start arranging the equipment they're going to use for this particular surgery. So this will include some of these blade handles, some forceps, some needle holders, and a host of other surgical instruments that will be specifically used for this surgery. You will also need to understand that the type of instruments that they are setting up depends on the type of surgery you're going to perform. For example, this one that is going to be performed is going to be performed on a patient who has a fracture of the shin bone or the tibia, and they're going to do an intermedullary nailing. So this set you're seeing here contains the instruments that are specific for that procedure and the type of nails they're going to use. So Adam, you can show her one of the nails that we have.
Okay.
So this is one of the nails that we are going to use for the surgery. So it's going to be embedded in the bone of the patient, and the fracture is going to be aligned, and the patient can start walking by tomorrow morning. So what the gentleman here is doing is, this is the limb that is fractured that they're going to operate on. As you can see, he is using an antiseptic solution to clean the limb, to make sure that most of the surface bacteria on the skin is eliminated, that the infection will not, or the bacteria will not fall from the skin into the surgical field. As you can see, this patient has a fracture of the leg, which occurred when he fell off from his motorbike. So as we've been speaking all along, if you could see the impact of road traffic accident and the amount of work it gives us. So this is one of those. So he's going to have a procedure called intermedullary nailing, meaning to say is an operative way of treating fractures. So ordinarily, this man would have been at home, probably sitting with some sticks tied to his legs, and he will not be able to walk for about 2 to 3 months. So after this surgery, tomorrow morning you will also come and see him walking already. So going into the process, this is the sterile area. All of this place has been prepared for the surgery to take place. So you have the surgeon on my far right, this is the assistant, and this is the scrub nurse. Okay, let's see. Now they've inserted the nail inside the bone, but the fractures are aligned. If you could see on the screen, that is what the interoperative imaging device is used for. You could see the bone and you could see the nail inside. So what the surgeon is doing now is to lock the nail inside with screws. So this is meant to make sure that the reduction and the fracture is aligned such that the nail will not rotate inside and he can walk on the nail without any problems.
Perfecto. 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 Save the one there. Save. Save the one. Perfecto. Perfecto.
The hospital is fairly equipped to take care of the type of trauma patients and orthopedic conditions that we treat. It will be fair enough also to say that yes, there is a lot of room for improvement, and that will require, for example, certain instrumentations that we will want to be around to make our work easy, and those things will really help in standardizing or uplifting the standards of the services that we provide. Let's say orthopedics is a very technical area, highly demanding, and you have a host of instrumentations that you use. These includes, for example, mallets, or locally people will call them hammers. We use chisels, for example. We use bone files. We use periosteal elevators, and other general surgical instruments, forceps, scissors, for example. And of significance, it's also good to mention that in orthopedics, most of the interventions we do require implants. Implants, these are approved medical devices that you will embed sometimes in the body of the patient, or sometimes you will leave them outside of the patient's body.
I will really be more than willing, so that I have the support from whosoever is in a position to support laying a private member's bill, to see how we are able to regulate the rate at which the road traffic accident is happening. That will be the point of departure. One, we have to look at the age of those who are vying to acquire a license. One, and two, we have to look at we have to ensure that they have to go through the vigorous tests. And then three, we have to ensure that the vehicles that are driving on the highway or everywhere are also roadworthy. Roadworthy in the sense that the vehicle should have everything that it takes for a vehicle to be on the road. So that's fundamental. That's one approach in ensuring that we reduce the rate at which RTAs are happening.
If I had the opportunity to bring a legislation to stop that, one, I want to bring a road administration to the police, extensively to the police. That means recommending of lights in the streets, and then recommending of the street bumps, what you call sleeping police, should be the responsibility of the police. The police should identify and have a technical team to do that. And then all the highways should have street lights. But again, What I wanted to do, and what I told the Inspector General of Police, when after the last accident happened around Gambia, I called for suspension or embargo of issue licenses in the country, and then the police should do a vigorous testing of all vehicles that are applying the road. Any vehicle that is not roadworthy shouldn't be allowed to go. Because this road vehicles that you see, they are applying, but most of them are not good. Because the brakes are not good, the tires are all finished. So these are problems that I believe should be part of the laws for us to bring it in. But again, the biggest part of it also, any offender should be a law, and it's only law in the country. Any traffic offender should be punished. One, you will be suspended, and your license will be seized from you for a number of years or number of times. Let's say, for example, I caused an error on the traffic that might cause an accident. I'll be charged at least to say, okay, 2 months you don't drive on the highway. If I cause an accident that costs somebody's life or lives, then I'll be banned from driving up maybe 5 years, 6 years time. So if that is done, people will be very, very mindful. So this is not a law that I want us to bring into law. After making the required environment on the road, this is a law that I want us to bring, that the police will be empowered to seize people's license and suspend them of driving. Some even ban them. Because those that did very bad driving, you ban them for life not to drive. So through that, we'll be able to clear road accidents or minimize road accidents on the highways.